Hi everyone, and thanks for joining us this evening. My name's Tommy Greene, and I'm the ambassador for Grandview Health, and I will be your moderator for this evening for the next half hour. We're excited to present our very first Facebook live chat. Tonight I'm joined by Dr. Paul Weidner with Upper Bucks Orthopaedics from Grandview Health. He is also the medical director at the Joint Center and the director of Robotic Surgery at Grandview. We are here to have a discussion and to answer all your questions related to joint replacement. We've both been vaccinated and we're socially distancing this evening, and that's why we're not wearing a mask. So Dr. Weidner, thanks so much for joining us this evening. It was great meeting you, by the way.
Yeah.
And for the first time, and we'd like to get right straight to the questions so we can answer everybody else's questions at the end. So we'll start off with the very first question. Before we get into how to fix things, let's start the question is how do we prevent things from your joints from wearing out?
Well, first of all, thank you for being here with us and being part of this Grandview Facebook Live. So thank you very much for being the moderator and taking your time out to share it with us and with it. And thank you for having me, Grandview, to be the first one on this project, and I'm looking forward to this evening and the questions that come up through that you ask, as well as participants from live Facebook. So the question you asked was, and you sort of had a little bit in there, is how do you stay healthy?
Yeah.
And really that's the thing. If we can stay healthy, if we can keep our joints limber, flexible, strong, that is probably going to be some of the best things we can do to stay healthy and prevent them from deteriorating. But as you know, things happen. You get your cleats caught in the clay on the mound, and you twist your knee, you hurt it. You may be the healthiest, fittest individual there is, and things happen. So sometimes these injuries happen, even though you're the healthiest, fittest person out there. But I think that, you keep a proper diet, you keep yourself in good shape, you do the things that don't injure yourself with low impact as you age. Maybe when you're younger, you can do more of the high impact and things. And those are the ways I think if you stay healthy enough, you prevent yourself from injuring or deteriorating the joints. But even saying that, it happens.
And you're exactly right on that. I mean, sometimes it does happen to me that way. And you hit on that with catching the cleats, which was a good thing. I mean, that I knew how to handle that. I had the doctors available, like as yourself, and not just you, but I had doctors available to do what you do and advise me in the correct way to do things.
And that's what happens. If you do have something that you get hurt or you do injure yourself, then you know who to go to.
Yeah. And
Grandview has a strong list of great doctors if you need their help, or healthcare professionals that you can look to help with it.
Yeah. And I want to remind people who are watching right now is also, we have the number here. We'd love for you to call if you need an appointment for anything, with Grandview, with our doctor here. They will answer your questions or whatever you might need. So feel free to give them a buzz.
Well, it looks like someone mentioned something already on Facebook. Put something up there that I put a hip replacement in someone 6 years ago, and he says it's working well.
Well, that's awesome.
Yeah. So everybody that's doing well, great. Thanks for sending in those positive remarks.
And hi, Rob. And as Rob Lane, we would need to say hi to him. So which is great.
Right.
So we're going to go along right now to the second question. Make sure we get these things in before we get the other questions. Hopefully people comes with questions. So y'all people out there, get your questions ready. So and please get them to us so we can answer them for you this evening. My question to you, the next question, Doc, is how do you know when it's time to have your knee or hip checked, by a doctor as yourself? And what are the signs and symptoms people should look for?
Well, one of the things you're going to have more than anything else is going to be some pain. Now, pain is different to everybody. Pain could mean soreness, pain could mean stiffness, pain could mean pain. And usually that's the predominant reason I see someone in my office is because they're having pain in their joint. Whether it's their hip or their knee, which I predominantly take care of, that's the main calling card that brings them in to see me. Now, They may have injured themselves and not having any pain, and they're concerned about their injury to make sure that everything is okay and nothing is, beyond the point where they think they should be doing more so than what they're doing. So they come in for advice, what to do, how to take care of it. But I'd say the majority of the patients who come in with arthritic joints, their knee starts bothering them, their hip starts bothering them, and you gotta remember, where is that pain? The knee pain can be anywhere, the front, the back, the sides, the hip. Usually we think of the hip as the groin, which a lot of people don't think of, but groin is your hip, or it could be on the buttock or the side. So usually those type of pains coming in to see me, stiffness, and they also start to not be able to do the things they want to do. They're not getting out there and being as mobile as they'd like. They're sitting around more, and that's not where people are nowadays. People want to be involved. They want to stay active. They want to be with their partner, their wife, their spouse, whoever it is. They want to do things. They want to be involved. They want to see their kids. They want to do things with their grandkids or their friends, their hobbies. All these things interfere with their daily activities, and they decide, you know what? I'm not enjoying being like this. I want to do more. I want to be involved more in the game. I'm going to go see Dr. Weidner and see what I can do to help.
And for y'all who are joining us this evening or just got online with us right now, the reason you don't see us with masks on is that we've both been vaccinated and we're social distancing. So we just want to let you know that we're very cognizant about other people. So we just want to let you know that right now. Doc, that's I know for me that last answer you gave me was, I'm getting older too. Some of the symptoms I'm seeing in my own body is, I have to read them and be honest with myself. This is sort of a little question, I'm sort of placing out there is for the people out there is to be honest with yourself. And if you having symptoms or pain, you got to diagnose a little bit yourself. Do I need to go to see a doctor? Does this bother me bad enough to me to go to see? Before it gets out of hand.
Yeah, and if it interferes with things you like to do, things you love to do and be a part of, why not at least get some advice on it and see what it's about? Because majority of time, we do a little treatment with whether it's medication or therapy or exercise or just diagnose something. It's calming to the patient to know what it's about and to feel comfortable to know what the problem is, and they can feel like they can get back involved in things again.
Yeah, exactly. All right, we're going to move forward to another question for it because we want to knock these ones we got out for you right here. It says, okay, let's say that I'm definitely going to need a knee replacement. All right, what are you going to discuss with me regarding the surgery?
All right, so someone's going to come in and see me because they're having, like I said, knee pain or knee discomfort or knee stiffness. We're dealing with the knee joint right now. And so what I'm going to do when I see them is obviously I'm going to question them about when that happens. How often is it occurring? Is it happening during activity? Not during activity. At night, bothering them for sleep? Not bothering them for sleep. I'm going to get an x-ray of that joint, probably the knee, if they haven't had one. We're going to assess that knee and look at it with the x-ray. And we may come to the determination that there's things that we can do without surgery to fix that knee. And usually that's the case. Majority of times, we don't have to do any surgery. We can treat it and do certain things that can, as I mentioned earlier, rehab it. Take some medication over the counter as long as they're able to take some of that medication. Do certain things to brace it, support it, physical therapy. Lots of things to do on a conservative aspect to help treat that pain and discomfort. But then there may come to a point where they're ready for surgery. So as part of that process, we're going to have a workup and a discussion involved in that. And it's usually multiple visits that this happens. It's not usual that someone comes in and says, Dr. Weidner, I'm ready for a knee replacement. Let's go next week and have it done. It's usually I get to know this person over time. We've tried different things over time. And they get to the point that they say, all right, I'm ready. I'm ready, Dr. Weidner. And that's what I tell people. You know when you're ready for a knee replacement, a shoulder replacement, whatever it is. You're going to tell me. I'm not going to tell you come in September 3rd, because I have an opening on that day. Really what it is you're gonna say, all right, I've been through all this, I'm ready to do something different. I'm ready to have my knee fixed, because I've been through medications, I've been through therapy, I've been through injections,
Yeah.
I've been through different treatments, and I'm at the point that I'm ready to do something different. So we'll have that discussion. We'll have a discussion about what entails with surgery.
Yeah.
What are those risks of surgery? What are the benefits? And when those benefits outweigh the risks, that's a reason to consider the surgery. If the risks outweigh the benefits, then maybe surgery isn't for you or for someone else. But if the benefits of having a knee that doesn't have pain, that doesn't give them discomfort, that allows them to enjoy things with their kids, their grandkids, their partner, their spouse, whoever it is.
Sleep.
Yes, sleep at night, exactly right. A lot of people that arthritic joints, they don't like to stay still at night.
Yeah.
Lay there with your knee, after a while it starts to get ache and painful because of it.
Mm-hmm.
So we'll talk about different things with the knee replacement. We'll talk about what to do before we do surgery, including I have them do a little bit of therapy ahead of surgery, because it's important to rehab that joint prior to coming in for surgery so you have the best outcome. And I'm gonna go through a list of things ahead of time to make sure that you're at your optimum and at your best to have that surgery and have a successful outcome.
All right, recovery-wise, I mean, it helps you get through that. You know, and on that topic a little bit, you hit on different things that you possibly could do. How about the robotic assisted surgery? Hit on that a little bit.
Well, something that's new at Grandview that we've been doing for several years, actually, and I've been doing for at least 3 years, is robotic surgery. And that involves getting a plan of your joint, whether it's the knee or the hip, ahead of time through a CAT scan, which is a special x-ray that tells me the perfect fit for, let's say, Tommy Greene, perfect fit for your knee. That's gonna come back to me with a plan. So when I go to do that surgery, and I do the surgery still, but I use the assistance of the robot to help me with the surgery. And what that robot does, it makes sure that I keep that plan that we've set for you, so that when I go to do the surgery with the robotic arm, it only allows me to cut the bone or the tissues exactly as planned. If I try to go outside the plan, it shuts off. It prevents me from doing things that I shouldn't be doing. So it makes me, after I've been doing it for 30-some years, it makes me a better surgeon.
Yeah.
It makes me more precise. It makes your outcome better, because now we have a fit that is custom fit to your knee through the robotic plan, and it only ensures that that's the fit for your knee.
Yeah.
So think about it. Afterwards, we have a fit on the knee that fits perfect, and it prevents me from injuring any of your soft tissues, your ligaments or anything else, because it keeps me in that confined box. And that allows you to rehab easier. That allows you to prevent from having a more difficult rehab. It's still rehab, it's still cutting your bone, and it's still surgery, but it allows it to be a safer surgery, a more precise surgery, and I think the rehab is easier because of it.
Everybody, if you have any questions at all to ask, or if you need an appointment with Dr. Weidner, here's the phone number right here. Call. They'll be able to direct you to get your answers. You know, we got some questions coming up. But also up top here, you know, Vicky's doctor is looking forward to her hip surgery on Monday. I guess she's having with you.
Well, Vicky, I'm looking forward to it as well. And I'll make sure I get a good night's rest on Sunday night.
Which is great.
Yeah.
You know, we do have a great, one of our people was wanting to talk about the partial knee replacement.
Yeah.
And you touched on it earlier. I
Yeah.
mean, before we were on air. It was very interesting.
Yeah, so here's an example of and I don't know how well it shows up, but whoa, there we go, that comes apart. That just means we have to do surgery again. But here's a knee replacement, and what this means is we're replacing the whole knee. That's a total knee replacement, meaning that the whole surface of the bone is replaced. Not that we chop the bones apart and put in a big metal piece. Really what this is just meaning all surfaces of the knee are replaced.
Yeah.
That's what a total knee replacement is. We still keep your ligaments and everything else about that knee to preserve it. Well, with a partial knee, and this is an example, Tommy, if I may have that, of your partial knee, and hopefully I won't pop it apart again like I did. This has an example of actually two partials. One is a partial medial compartment knee where we only fix the inside part of that knee. And that's because only that part of the knee was arthritic. And the rest of the knee was fine, so we let the cartilage of that knee go and everything else was just fine. This is a kneecap or a patellar replacement, and that's just if your kneecap part goes bad. So there are different, and then obviously there would be a partial knee replacement for the outside part or the lateral compartment as well. So there are various partial knee replacements. And the benefit of a partial knee replacement is that if you're only replacing part of the knee, you're keeping more of your own parts, more of your own ligaments, and more of your natural parts that make it a more easier recovery and a more simpler recovery. So that there's less surgery, it means for an easier recovery and back to function quicker. The nice thing about the robotic, which we mentioned earlier, is the robotic makes that partial knee replacement repetitive and reproducible because it comes with a plan and it makes it that I can do that surgery reproducibly easily. In the old days when we did partial knee replacements, we didn't have that. We had to sort of like artistically do it and change it and do the partial knee replacement. And it just wasn't accessible. Now with the robotic, it ensures that we do it the right way. It ensures that balance of that joint, and that allows for a partial knee replacement that should last just as long as a total knee replacement.
Yeah. But I'll tell you what, learning about this, I mean, it makes me feel my own body a little bit. And you're talking about these knee replacements and stuff. I'm sort of feeling my age a little bit, you know. But typically, and it leads into people who, if I was to get surgery, what on the day of surgery, what is it like for the individual, for us who haven't been, you know, through surgery?
Right. Yeah. So we've gone through the process. We've decided upon surgery. We've got that CAT scan plan for the robotic part of things. You come back to my office right before surgery, and I'm making sure that everything that we've set up is set up right. So again, that we optimize your surgery so that when you come in for that surgery, you have hopefully the best outcome you can have.
Yeah.
And that's what it's about. So then when you come in for surgery like Vicky on Monday, we have everything set up right. Everything's been double checked. We have medical people that have cleared you for surgery. We've answered all the questions ahead of surgery, and I like to bring people back a second time just because other questions come up.
Yeah.
And you know, and we also have a portal available through our Grandview network that you can write in questions to me as well prior to surgery or about surgery that I get back to you and answer on the portal.
Yeah.
But either way, we answer as much as we can ahead of time.
Yeah.
They come in for that surgery, then they're ready for that surgery. They're at the optimum health that they can to succeed and have a good outcome on their total knee replacement or partial knee replacement or hip replacement.
Yeah. Well, I mean, we got a couple things going on the arthritic knee. What is the progression and prognosis? You know, as far as any injections type things, or it goes on with something like that, or
right. Part of the conservative treatment, again, where I talked about most of the time we do conservative treatment, injections are a big part of that. Yeah. Whether they're steroid injections, which are a strong anti-inflammatory and help relieve the pain. And usually when we're doing a steroid injection, you already have arthritis. Your knee is already worn out, and or your hip or whatever joint, and you're looking at something to buy you some time.
Buy you time, yeah.
Patch it up.
Yeah.
Patch me up, doc. I'm not ready for surgery yet.
Yeah.
Right, but I may be whatever. So these are patches that we're applying.
Yeah.
I don't have the fountain of youth. I don't have anything that I give you, and that joint's going to be normal again.
Yeah. I mean, and that leads to some of the question. I mean, another question is like people want to know when they're going into surgery, and how long is it gonna lay me up for? How long am I gonna be in the hospital with this, or with a total knee or partial knee?
Right.
You know?
Now we're doing the surgery as outpatient, same day
Wow.
surgery. So we went from a total knee or a total hip that may have stayed 30 years ago in the hospital for a week to now doing it the same day surgery. You go home the same day.
Yeah.
Now, a good amount of people will stay overnight. And if people need to stay an additional night, Grandview is accommodating. We will keep you as long as you need to. But majority of people are becoming younger and want to be back at home quickly, and they don't want to stay in the hospital. And so they're going for the surgery sooner than they used to. And because they're younger and healthier and having surgery sooner, they want to get back in that game sooner.
Yeah, you know, and that's a question. I mean, the prognosis after you do a surgery like this is what kind of short-term, you know, recovery are you looking at, and long-term type thing. You hit on things. The younger you get it, does that make you susceptible, maybe having to get it another one later, or that type of thing, or? And that brings in the questions of what materials and stuff you use, and all different kind of things, and the life expectancy of things.
And just as a reminder, Tommy and I are both vaccinated, and we had our masks and everything. We took them off to talk about it today, and we're trying to keep our social distance as well. But the parts that we put in now can last 20 to 30 years. So, you know, a lot of times people are saying, you know, I'm ready now. I don't want to wait till I'm older because I don't want to miss these years of doing things that I enjoy doing.
And that raises the question of youth and rehab after.
They rehab it better when you're younger as well. I think that's a little common sense, but yes, not that anybody can't rehab it.
Yeah.
It's a possible, but when you're younger, you may think you can do better with the rehab. If you do better with the rehab, you might do better with your joint and feel better about it overall as well.
Yeah.
So I think that these joints last longer, and people are more willing to have a knee replacement and a hip replacement because of the success. They are 95% successful at relieving pain, allowing patients to do more, and to be involved and participate in activities that they hadn't been able to. So that's great.
Okay. Hey, Doc, we got a shout out from Jim. You did surgery 15 years ago and made part of his body feel young again. His hip done 5 months ago also feels great. Well, Jim says thanks to you.
Well, thanks to
found
Jim.
the youth right there.
Yeah,
sounds
right. Thanks to Jim for calling in or to Facebook and live with us, and I appreciate that, Jim. Thank you very much.
That's awesome. I mean, and that sort of answers a little bit of another little question that people, when they come for the consultations, you probably hear is, how much does this hurt? How painful is it? You know, but and I know, I mean, it's hard to put a number. People handle pain in different ways.
You're right.
You know, and everybody's different.
Right, and that's it. Just as people present with different types of pain, people handle surgery afterwards differently as well with the pain. But the nice thing, and I think we have done a great job. Listen, when you used to stay in a week, when I started 35 years ago, you stayed in a week because of pain and discomfort and rehab. Well, now the rehab process, the pain process has improved. You go home the same day. We do so many things to improve the pain part of it and to help with the rehab that these patients are comfortable going home on pills that their pain is well controlled. The robotic surgery adds the precision that's needed. It allows, we maintain their muscle, and we do a quad sparing approach when we do a knee replacement. So we're doing the things that make the rehab easier. We make it easier for them to tolerate the pain and discomfort and to rehab it well. That's not to say that they don't have any pain or discomfort, because we're cutting the bone, we're cutting.
Yeah, you're doing some major action there.
And there will be pain with that.
Well, I mean, you're talking about pain, and you know, my personal. I mean, just a question personally. You know, do you staying on top of the pain after surgery, not letting it get out of control? Because some people don't want to take medication and stuff like that. But how do how do you stay on top of it?
Yes.
You know, I mean, ice, I mean,
Well,
I mean, or what, tell me some of the things you can do, you know, for people who don't like, say, speak the medication or try not to take it.
Right, and there's a lot of things that we try and do that I think are helpful. And what we call it is multimodal pain therapy. And what we'll do there is we'll give them various types of pain control medication, like Tylenol, like Advil. And if they need a narcotic, we will give that to them. And other types of mild pain relievers, muscle relaxants. You throw that whole combination at a small amount, and that's what we call multimodal pain relief. That has an effect better than throwing a whole ton of narcotics on them and making them drowsy or whatever. So it's just the way to going about treating pain now is so sophisticated and improved that it really makes the rehab process a lot easier than it was.
We got a question here. You know, maybe you should read it. Maybe you can
All right,
pronounce it
all right.
better than I can with the
Yeah.
big words. You know, so
Yeah, it
I'm gonna
says-
let you handle it.
The question is, does hip surgery fix avascular necrosis for good? So avascular necrosis is where the blood supply to the hip in this area is deficient, and the bone, because it doesn't have that blood supply to build that calcium and that strength of that bone up, it crumbles and deteriorates. And you get an arthritic hip from a crumbling avascular, no blood supply hip. And yes, hip surgery will fix that portion of it. Now, it depends on when we see the blood supply leaving. If it's early on with an avascular hip, we can reconstitute the blood supply to the hip through various vascular procedures that help allow that bone to stay healthy and strong. Once it started to deteriorate and have an arthritic hip, then a hip replacement will treat that.
Now, you start talking about that, and it brings me to, you know, athletes again. And you're talking about blood supply to the hip and stuff. Now, maybe you can answer this question for me, being Bo Jackson. I don't know if you remember that football player. Was that the type of injury that caused the blood supply to the hip, and sort of the same type of thing?
Right, exactly. He dislocated his hip playing football. He got tackled, and the hip popped out of the joint, and in doing so, destroyed the vascularity around the hip joint. So that caused the hip blood supply to be cut off, and his hip went bad, and he ended up with a hip replacement.
One of the best athletes I've ever seen in my life. Ever.
His skills were unmatched.
You know, I mean, we talk about God in athletics a little bit, but you know, I've lived a life of rehab or trying to prevent injuries and stuff like that, and I know sometimes you can't. I mean, it just happens, like you say. Sometimes it just happens. That's what I figured out myself. I took care of myself and tried to prevent and do maintenance, like a maintenance program all the time. But my injuries still happen, and I come to grips with it. And you have to deal with some and have a mindset going into your surgery and about your rehab of what you're going to do. I think it's a mindset to help you. If you have to have surgery, I mean, that's what you got to have. And I think, I mean, that mindset of being able to, okay, this is what I'm going to do. I know it's going to be difficult a little bit, but I'm going to make it through it, and I'm going to work my hardest to get through it. You know, and then if you tell yourself positive things seem to, you know, to happen. Everybody, we have the number here. Please contact us here at that number. For Dr. Weidner, you can get an appointment with him, or they can answer any of your questions you might have. Okay. You know, we have a question here. What if it only hurts when you walk?
With the avascular necrosis?
Yeah.
Will it eventually just collapse? Yes, it eventually will. If that blood supply doesn't return, that bone is not going to have the support it needs, the scaffold or the strength to it, and it's going to fall apart and collapse. And
I mean, that's not very good.
And you were mentioning the rehab and having the right mindset, and hopefully in preparation for a hip or a knee replacement, that's the process we take you through here at Grandview to prepare you for this surgery. As I mentioned, I want to optimize you coming in for that surgery so that you have the best outcome, but I also want to optimize that rehab process for you and get you in that right frame of mind and hopefully hopefully have you prepared for it. Because as you mentioned,
It's huge.
if you're prepared for it,
Yeah.
it's gonna make a big difference.
Yeah, it's huge. It's a huge thing. All right, guys, it looks like that's all we have time for tonight. But before we wrap things up, I wanted to let you know that our office is still open this evening. If you would like to schedule a consultation with Dr. Weidner or any other orthopedic doctor that we have here, you can call right now at 215-257-3700. Dr. Weidner, I want to thank you for all the information and taking the time out of your schedule and to talk to us about joint replacement. You know, and thanks to everyone who joined us this evening for our first Facebook Live. You know, it's our first time doing it, so I have thoroughly enjoyed it. We'll be scheduling future events, discussing maybe some various topics, some other topics that y'all might want. So just stay tuned on that one. Thanks again to all who have joined us this evening, and have a great evening.
Thank you, Tom. Thank you, Tommy, for doing this.
Hey, I enjoyed it, man, as always.
Thank you, everybody, for being a part of this. And I appreciate everybody who came out tonight and everyone who's put in the good word out there. Thank you very much for participating in this.